It's a touch after 7. As new people join us, I will let them in. But at this time, I would ask Karen Rothman to introduce our guest.
So it is my pleasure to introduce Dr. Sara Manning Peskin, who is the author of tonight's book club selection. Sara earned her undergraduate degree in biochemistry from Harvard University, where she graduated magna cum laude. She then moved to Philadelphia, where she received first a master's degree in cellular and molecular biology, a medical degree, and then completed a residency and fellowship in neurology, all from the University of Pennsylvania. I met Sara, who is my niece, when she was 2 days old. She has always had an intense love of adventure, travel, and experiencing life to its fullest. During her college and medical school years, she traveled and volunteered extensively in Ecuador, Cairo, Ghana, Malawi, and South Africa, where she had a profound influence on many of those she encountered. While in Cairo, for example, she taught Arabic to refugees from Darfur and befriended a young man who then got a job as a translator for the United Nations. Her spirit of adventure is perhaps best captured in an article that she wrote for the New York Times about getting lost in the Amazon with her husband on their honeymoon. For the last few years, Sara has worked both in the Penn Memory Center and the Penn Frontotemporal Dementia Center. In addition to her day job, she continues to travel, now with her husband and 3 young children. Sara listens intensely and truly believes that there is something to be learned from every experience she has. She sees hope and promise where others see only despair. This makes her beloved to her patients and also makes her particularly well suited to teach those of us in the medical field, as well as the lay public, about how to approach those with neurologic afflictions. I look forward to listening and learning from Sara today and can't wait to hear about her next adventure.
Okay.
You're not biased at all.
Well, thank you so much for joining us. This is just absolutely wonderful. And thoroughly enjoyed your book. I have to say that just the clarity and the way you express complex ideas in a way that is so easy to understand is really remarkable. And just your the way of telling a story. I think is something that I really appreciated. I was just telling Karen that more than once I was just sitting there reading paragraphs over again to my wife because they were phrased so beautifully. It's lyrical. So this is really a terrific book for a lot of reasons. And even though it doesn't go to market as a history book, and we're a history of medicine book club, it fits in here in an even better way, because it puts history in context. It tells the story using history to provide perspective and to allow us to have an understanding of what is here today as well. So you pursue things in a manner that I think respects the idea, the place of history in learning. So thank you for all of that. I also have to say that medical training is very intense. It's a socializing procedure. You learn to tell a story in a certain way. You learn to develop ideas and the like and present. And this sort of thing aims to be brief. It aims to be direct. It nothing but the facts, nothing but what is necessary. And join the tribe by using the lingo. So we get socialized into these terms, which may not provide more information, but indicate you're there. And I read this book and I said, "Holy Moses, how did you separate those 2 lives?" Because what you're doing is in many ways pursuing ideas to their deepest depth and also expressing things in a way that is very clear and simple. So very different from the way we're all trained to work. And I wanted to open up by just asking you to comment on that. You don't talk like a doctor, and what I read wasn't anything that would make it through a morning report. And so I just wondered what your thoughts were there.
Well, even in residency, I had trouble making it through morning report. So, so I think that's nothing new. Um, but I think when I wrote the book, um, I mean, the goal was to reach people who didn't have medical training, and the writing group that I'm in is essentially nobody else is in medicine, and that was like the most helpful thing because people would write, they would just underline stuff that they didn't know, and sometimes it would surprise me. Like I remember I wrote the word dusky, and I thought that was like a description of a type of color, and someone was like, I don't know what that means. So it actually it was very good for me to realize how much of the words that I use were not accessible to most people.
Mhm.
Um, and then I think the other thing that I ended up doing was trying every time that there is some jargon in it, but I sort of tried to figure out anytime I actually introduced jargon, like, did I actually need that word? And that was also a useful exercise. And just sort of going through the whole book and saying, like, anytime there's a word that's hard terminology, do people really need to learn it? And I think in the end, actually, I was aiming for like basically like high school graduate, sort of college, but no science major or something like that. And in the end, um, I think it's like being used in a few high schools. So I might have written it for like a different level than I had expected. And I know like I think I sometimes wonder if I should have left more in. So I don't know if I hit the right sweet spot. But it was just sort of a process of getting rid of more and more of those words.
Hmm. Now, this writing group, how did you come to be in a writing group? How did that go?
I I only started writing really in intern year because we had our night shifts was like in blocks, so it was like 2 full months of night shift.
Mhm.
And some of those were like horrifying, and then as you guys know, some of them are surprisingly quiet. And then that's when I started writing. And then a few years in, once I started working on the book, I realized like so much of writing is actually having other people read it and explaining to you how to restructure thing and how to rephrase things,
Mhm.
and sort of learning the rules of writing. And there's a Penn has like a writing, it's like Kelly Writer's House. It's like their writing center, and this was just it's like the adult writing group that's attached to it. Um, and they've been incredibly helpful. That was like one of the most useful tools for writing.
Mhm.
It still is.
Hmm. All right. Well, our usual format for these reviews, when we don't have the pleasure of having the author here, is for people to go to make sure that everybody has an opportunity to say something or ask a question or the like. And so what I'd like to do, and then if we have a little more time later, we can circle back and I can certainly think of a few things to say. But what I'd like to do is just ask the people who are watching now if you can raise your hand or whatever, and I can recognize you and you can either ask a question or make a comment or the like.
And I should say you should feel free to say critical things also as if I'm not here because I'm working on another book, and so it's helpful to know what worked and what didn't work in this book. So you should
Wow.
feel as comfortable to talk as if I'm not here also.
Hmm. Hmm. All right. I can say a couple of things here. First of all, one is that again, I love the way you did your research. You know, you start with a story of the patient, and then you work your way back to the childhood of the person who just made the original discovery that helped the next person who made a discovery. You went layers back in your research, and I wondered, is did you start this many years ago? How long did it take you to compile all of this? Because just trying to imagine the process of researching out just one of these stories, it struck me as being really remarkable.
So I started it. It took me like 6 years basically. So it was a long-term project.
Hmm.
It was 6 years and I guess two of the three of our kids from the beginning by the time it finished. And at the beginning, I decided I wanted to do like a book length project, and I just wrote like a list of the diseases that I thought were most interesting. And
Hmm.
then I was sort of asking around of like who had interesting patients. And then the first interview I did was the patient with CJD. And so I just went out to his wife's house. And I think I was nervous at the time because I didn't have a book deal. I was like, I don't know exactly what I'm going to be able to do with it. But it made me realize, that interview made me realize that it's fulfilling for family members, I think, to sit down and like tell their illness stories. And she had been through this traumatic time with her husband, and she had, shown up to the ED and said, this is what's happened in the past few weeks. And then, she sees like the resident in the ED and she tells the story, and then she sees someone on the wards and tells the story. And then she goes, he goes to hospice and they tell the story. But there's never a time actually in illness courses where patients typically, or family members typically, sit down and say, like, this is where it's been from the beginning to the end. And that was very useful for me to realize that I'm not imposing on people to do this. Yeah. And then initially it was mostly going to be just sort of illness stories. And then I realized, essentially, I think one model for doing that is you describe a patient and then you say, like, oh, I didn't know what they had. And then, I thought about this and we got this test and this test. And then ta-da, like I discovered the diagnosis. The problem with writing that way is that it becomes very sort of centered around the physician. It becomes a book about the physician's, ability to think about exciting, or to sort of think with a novel eye. And I didn't want to write it in that perspective. So instead I decided to go like tell the story and then go back instead to the history of each disease. And that was actually neat because to be honest, I didn't know any of that stuff from residency. And it was neat to see the history of the diseases that we talk about, and it's changed how I practice now. So I, like, now when I give patients a diagnosis of Alzheimer's disease, I talk about like the original discovery, and I think it's kind of useful for people to figure out where their diseases came from. But yeah, now I've gone off topic.
Well, no. This is really great, because I think that, the other thing that was occurring to me besides the morning report piece is that, we're at a moment in time where people are, they're feeling a little pressured, they're rushed along, they have to focus, don't pause. And we're also at a moment in time where where people are finishing their training, and a quarter of them are, burned out. And people are retiring early. And I look at what you've done, and I think that right in here, there's a little bit of something for everybody to learn regarding approaching their career. And I just wonder if you might say a few words about how you view your practice and this approach to seeing patients and writing a book and things like that. How are you viewing your career as a physician, and how you make it feel, I guess, more satisfying?
So I think for me, this is kind of my solution to burnout. So when I first started med school, I started off in like a MD PhD program, and I had wanted to like run a lab and do sort of hard science. And then I got like a year into the PhD, was very unhappy doing research. And I realized, like, you're supposed to be unhappy 4 years into your PhD, but not 1 year into your PhD. So I thought that was not a good sign. So I ended up quitting my PhD and then finished med school and kind of didn't know what I wanted to do. And then writing kind of came in as that this is like my other piece. So instead of doing, I do clinical research visits, but I'm not driving the boat in any research in any major way. And this has been a great balance. And it's nice to have like a creative outlet. I feel like work is kind of a emotionally engaging outlet, because working with families with neurodegenerative diseases is emotionally fulfilling. And then this is kind of my creative outlet. And it also writing also works well, because you can sort of do it anytime. If I have a large chunk of time, I can sit at the computer and try to write stuff. And if I have 5 minutes, I can read a sentence. I was in residency, I think I always felt like it's like if the med student's talking about the family history of a 95-year-old patient, that's like the perfect time to edit a sentence. So it sort of can be done in these really small chunks. So I think that's been useful. And right now I'm basically 80% time. And so I have 2 full days of clinic, and then I have 2 days of like meetings and research visits. And then Fridays I'm off for writing. And that's been mostly good. I have to be better about protecting them, but that's been sort of a good way to balance it.
And, you have 2 children?
And we have 3 kids. Yeah.
3. How old are they?
they're one is just turned 6, and then almost 3, and then 7
Oh,
months. And so
oh,
yeah, the
wow.
7-month-old may be in maybe in at some point. He may be joining the book club.
Okay, well, that's fine. So again, group, raise your hands, indicate to me in whatever way, if you want to make a little comment. Otherwise, I'm going to keep going here. Just so I want to circle around this business of you're writing a book a little bit here and get the idea. I mean, at some point you went from being interested in your patients and researching out these interesting backgrounds to saying to yourself, I want to write a book about this. This I have the content, and you've you located a publisher. Did they provide you with a publicist? Because I've been listening to more than a few podcasts since your release there, and I'm assuming that your publisher was working at that.
Yeah, so and I didn't know any of this. The way that it works is, so I had written some articles, and then some agents had reached out, and then I engaged with an agent, and then you work with the agent to make a proposal, and then they submit it to the publishers. And then one of the best advice I got from our chair also had wrote a neurology book about the teenage brain, and she said she basically said, like, you should hire your own publicist. And I was like, oh, I don't need that. And then like 2 months before the book came out, I was like, oh no, I definitely need that. And that was outstanding advice. So the publishing companies will give you a publicist, but they're focusing on tons of different books. And then if you hire someone separately, they sort of focus a little bit more.
Oh, and did she recommend a publicist for you?
And actually, the agent recommended one.
Yeah. Wait, in your chair, what is her name?
It's Frances Jensen. I don't know.
So she wrote. I mean, the title of the book is The Teenage Brain, right?
Yeah, exactly. Yeah, it's
I read that. That's an excellent book, actually.
Yeah, it's a neat book. Although horrifying now that I have 3 boys.
Yeah. And got one more let in here. So yeah, I think that, that whole process is just very interesting. Locating the right people, locating a publisher, that kind of thing just strikes me as being something that these are different worlds. Nothing in your training really set you up for that.
Can I say, so the folks in the group that you, are you mostly folks who do writing, and what type of medicine are you in, and how did you end up coming to the group?
So we're retired physicians, a lot of us, wildly different specialties and everything. I'm a retired OBGYN. I was just telling Karen I retired 9 years ago. And we enjoy medical history. Thorough Peterson is in here, or he wasn't here. He is not a physician, but he was in charge of the Worcester Foundation for Experimental Biology, and has a huge depth of knowledge regarding many things that are involving medicine. And we've got infectious disease people, general internists, a lot of different specialties, nephrology, a lot of different specialties here, but a lot of us are retired. So yeah, that's kind of our background. Just very diverse. And as I say, we enjoy these. This I think is our 30th meeting that we've had. So we've been doing this for about 8 years or so. And it's an enjoyable thing for us. But as I say, I think one of the things that we see and we're confronting is this idea of people entering medical school just with a load of idealism and energy and knowledge and everything. And by the time they finish their training, they're moving away from primary care, they're burned out. And the hardest part for many of them is clinical practice. And many of the components of modern clinical practice have made it harder for people. And so I see you as a very interesting study in how to deal with modern practice and thrive. It sounds to me like you certainly write well, and you certainly speak positively of your time with your patients.
I think that the balance is I guess everyone knows that the balance seems to be important. I know that the person who did the fellowship that I did, the person who actually, and not fellowship, but the job that the first year of the job that I did, the person who did it last had, I think, 4.5 days of clinic per week. She did 1 year of it and then went and became a stroke fellow because she sort of said that was way too much. So then they changed everything. But it really does seem like that sort of having some other creative outlet seems to be really useful for people.
And maybe the piece of part-time there, I think, is kind of an important piece. It opens up the opportunities for doing something else as well, or complementing what you do with something near it. So, that is another interesting piece there. I'm also interested, just less with the history, but with the notion that your pursuit of the chemistry of neurology is and the chemistry of behavior really is such that it is moving towards making psychiatry a little bit more scientific than it's been in the past. And I just, you were approaching it from the chemical point of view. I just wondered if you had any other insights with regard to the research that's going on today, and what other fronts are advancing to understanding, how the brain processes information and how it affects behavior.
I do think we're sort of coming. It's sort of like there used to be neuropsychiatry, and then it splits in the late 1800s, and now suddenly you have two different fields, and then we're kind of slowly like coming back together. And cognitive neurology is actually like at the seams of it. Half of what I do is psychiatry, and most of the medications I prescribe are psychiatric medications. And so, and I do think that when you look, it's mostly in sort of esoteric things where we're now finding people who come in with psychiatric presentations, and it turns out that it's a neurologic disease. But I think there's still a ways to go in terms of like your typical case of schizophrenia and being able to have someone come in and say, oh, look, here's the molecular problem. So I think we're still kind of on the fringes. On the other hand, they're like meaningful cases when people come in with stuff that's never, that sort of otherwise would be untreatable and now suddenly is treatable.
Karen, any comments on your side?
I think, Jeff.
I want to say that your writing style is much better than most physicians ever achieve. And I'm curious as to whether or not you had any training, perhaps as an undergraduate, in how to write so well, having been an English minor and written long papers. For me, it was like extracting wisdom teeth to get those papers out. And I hope that you were somewhere along the lines instructed in how to write well, because you do.
Thanks. I appreciate it. I always feel like in retrospect, there's all these writing classes in college that I never took that I wish I had done. Because everyone has those like freshman courses, but I don't really have any good formal training in writing. It was really, honestly, it was from this writing group. It's just having people, read your stuff and tell you how to fix it has been like the most incredible gift. That's, I did some of the writing before that, but that's, I think, what allowed me to learn actually how to write. And then the other big piece is the guy who is the editor for the Modern Love column. He wrote a post years ago now with like 50 rules for writing, and they're like invaluable. There are things like, it's like always use that instead of which, unless you actually need to use which. So it's like a rule that you never would have thought of, but comes up often. And things like, take out every adverb unless it's absolutely necessary. So it's just a very useful, it's like a really useful set of rules. And that I think was the other big thing that taught me how to write. And then I think also has been learning how I write versus other people. So there's a book, I'm blanking on the author's name. It's called Heart a History. Sandy Johar, I think.
Johar,
yes. And I remember talking with him once, and he was like, I was sort of asking him about his writing process, and he was like, well, as I'm going to work, I just dictate, what I'm writing, and that becomes the book. And I was sort of like, nothing that I say comes out anywhere close to eloquent. So I think some of it also was just realizing that my writing process is like extremely slow, and that's okay.
It is okay. Absolutely. exceptionally well.
Thanks, I appreciate it, especially coming from someone who's an English major. I really appreciate that.
So talk to me now. Somehow I missed how you got together with this writing group. How did you find these people? They're not in medicine, so what's
They're
the
not.
deal?
They're actually just. They're kind of just community people. They're. It's a group that initially was like it's run through the Kelly Writers House at Penn,
Mhm.
but no one's actually affiliated with Penn except for me. They're just one person is a creative writing professor, one person's a rabbi, one person was like used to work like in computers. So they just are. They're sort of from all walks of life. But I think that I guess because I didn't do college writing, I never got that experience of like, sitting around with in sort of a group critiquing other people's work
Right.
and getting your own work critiqued, and that it's been useful.
How often do you meet with them?
And we meet every other week, and everyone
Oh, wow.
it's sort of it's a big range of what people write. So some people do nonfiction, some people are doing fiction. One person's writing like a epic novel about ancient Rome. But the reality is actually that editing other people's stuff has been helpful, even when it's like way off of my topic.
Mhm. Hmm.
Um,
Yeah. Well, you had mentioned that was very helpful to you as well. Good. What is your next book going to be?
Actually, I just submitted a proposal for another book. So I want to sort of write about kind of like the history of neurology. So the goal is to think about it functionally and say, well, look, how did we discover that a nerve works by transmitting electricity over the course of the nerve? And then you could say, well, if a nerve, if a nerve transmits a signal electrically, then how do you make sure the electricity doesn't spew out to the rest of the body? And so how do we discover myelin?
Mhm.
And then you could say, well, okay, the signal gets to the end of the nerve, and how did they figure out how the signal then crosses to the next nerve or to a muscle? And then looking at the history of neurotransmitters. And then with each of those things, also looking at, well, what disease happens when you get a problem with that? So, for the chapter where it's about the history of Volta and Luigi Galvani learning about that nerves are electric, then it goes into the story of a woman, modern day person with epilepsy, who had a device implanted in her head that actually helped to detect and cure her epilepsy by delivering intracranial shocks. And so it's sort of what's the modern iteration of those sort of normal and abnormal pathologies.
Mm.
So that's the idea.
Yeah.
But I'm waiting to hear back, so I don't know if it's any good.
Oh, geez. Well, it sounds interesting to me. I read probably within the past 6 months a book along those lines. I think it's called "We Are Electric" or "You Are
Yeah, it's
Electric"
a
or
beautiful book
something.
with Sally Adi. Yeah.
Yeah. It's really an interesting thought process. It's a whole different angle on physiology and biology, and addresses a lot of questions, that aren't covered by our usual models. That
Yeah.
business
And the
of
history is wild.
charge.
There's all the stuff about like Luigi Galvani kind of just died in obscurity, and nobody really
Yeah.
believed him. And then his nephew picked up the baton and decides he's going to prove that nerves are electric by like electrifying decapitated corpses of prisoners.
Yes. Yeah.
And that became the basis for Frankenstein.
Mhm.
So there's all these like amazing history stuff that's neat.
Yeah. You're going to do a great job with that. I can't wait to see it. So Karen, you're next.
No,
Oh,
that's actually
Gordon.
me.
Gordon.
So I'm just curious. So nowadays, we have everybody, patients can read notes. They have part of the Cures Act. So I'm just curious how your writing has influenced how you write your notes, and whether you keep in mind that patients or their families may be reading this, and does that influence how you approach it?
So I always think of there was a lecture that we had in residency where someone gave a talk where it was basically where it was sort of a patient where the notes had tons and tons of quotes in it. And the lecturer said, when you quote a patient, it means either they're completely crazy or you have no idea what's going on. And I thought that's so spot on in terms of how we write notes. I think for me, it has knowing that patients are reading things does make me think a little bit more carefully about how I phrase things. In particular for us, we often interview families separate from patients. And so it poses a problem because I sit down with a family member and I'm like, oh, tell me the things that you didn't want to tell me in front of the patient, but then I'm putting this in this chart. And unless I mark it, the patient can read it. So it's actually brought up an issue for us in the memory center. And the other thing actually that came up recently is everyone has these dot phrases where you fill out whatever sorts of things. And we had a part of our dot phrase is the review of systems part. And it says, they have or don't have psychiatric illness. And this patient, called and said, well, I have anxiety, but I don't think you should write that I have a psychiatric illness. And it was sort of an interesting discussion with her of, well, I usually think of anxiety under the category of a psychiatric illness, but she found that offensive. So I do think it's kind of made me understand a little bit better. I think from her perspective, she felt like it was too nonspecific, because she didn't, from a patient perspective, she doesn't realize that this is just a paragraph about review of systems where I'm just categorizing which areas have some sort of pathology. It's brought up conflict, I guess, at some points. And also sometimes patients will write and say, you got that wrong. I had diverticulitis, not diverticulosis. In my mind, I'm like, we're talking about neurology. That's relevant for your Alzheimer's disease. But no, it's brought up issues. I think that the nice thing about writing and patient care that's kind of a nice interface is that it's basically the same skill set. That when I write a note, all I'm trying to do is lead the reader through a story of how this person's symptoms ultimately end up into the conclusion. It's the same thing as writing a chapter. It's, when I write a chapter, it's here's all these different clues about this person's symptomatology, and then here's how we put it together into this final diagnosis. And in retrospect, I think if I'd realized that in med school, I probably would have been a better medical student. But it's kind of the same thing. It's trying to lead someone on a story without them feeling lost, and where they feel like at the end that they had the right pieces to figure it out.
Thank you.
Thank you. Michael, you're on.
Oh, hi. Yes, Michael Newstein. I'm an infectious disease physician, not retired yet. So I am interested in, potentially doing other things creatively. So trying to struggle with that, maybe working somewhat part-time soon. I enjoyed your book. I really enjoyed the historical vignettes, but I was curious about the title. Because when I came into it thinking that, you'd be, it was a great chapter, for example, about the autoimmune psychosis, which, was a molecule away from madness. I think the other illnesses were in some ways a molecule away from madness, but, more indirect sense. And I thought you might have been going into, based on the title, more about psychiatric conditions like schizophrenia. So I was wondering about the title and your choice of which illnesses you included.
So the illnesses I included were mostly, basically I was like, what are the illnesses I'm interested in? And I'm in cognitive neurology, so I mostly focused on cognitive ones. And then I tried to figure out which of them could I link to a single molecule. So there were some diseases that I see a lot of and I'm interested in, but I couldn't, like Lewy body. It's very, very rare to find that caused by a single genetic mutation. So that one was hard to integrate. But FTD or frontotemporal dementia, 20% of cases are caused by a single mutation. So that sort of feels like a more sort of reasonable jump to make. And Alzheimer's disease, the autosomal dominant variants, even though they're rare, are playing a big role in terms of the research effort. So that felt like that could fit. And then there were some conditions that I wanted to do that I didn't end up being able to do for one reason or the other. The big one was I wanted to do magnesium toxicity can cause Parkinsonism. And then when I tried to find cases, it turns out it's all like mired in legal cases. So at one point I was like emailing lawyers to see if I could talk to their clients about this. And then I was like, this is above, yeah, I was worried I was going to write something wrong or write something that got me in trouble. So I ended up sort of bailing on that chapter. And then I was going to write a final chapter. I interviewed a kid who had seizures that were caused by a genetic mutation, but he also had non-epileptic events. And so I was going to sort of write about, the complexity of having things that are caused by a single molecule, but also having mimics that look like they're, have this cause but aren't. And I just ran out of time for that one. I think that actually would have been a fun chapter to write. But it came up on 6 years, and I said we had to close this out. But those were the 2 chapters that I think I had been thinking of writing that I didn't. And I think that was an issue with the title in retrospect. I think that you're not alone in sort of feeling like the title was more of a setup for a psychiatry book. And I didn't realize it until it came out that that's what it implies more. The initial title was A Molecule of Madness. And then I had given a presentation in residency about it, and someone had suggested a molecule from madness. And then someone pointed out that that's grammatically ambiguous. And so then that's how it went to A Molecule Away from Madness. So that was the evolution. Yeah.
Thanks.
Nice. Good. Okay. Further comments from the panel? Here we go. Go ahead.
I was impressed with the certain history of the treatable disease like pellagra and thiamine deficiency. And you really went into detail about the 100 years ago, what happened and how by accidental chance the medication were invented for thiamine deficiency and pellagra. Because I was in India, I seen a lot of cases of pellagra as a medical student.
Was it easy to identify, or was it does it not look as stereotypical as?
No, we don't have any specific tests, and it was just a clinical thing, and people were treated. So, but
And it sort of looks like
looking at your reading your book and your chapter was very interesting. The whole history, how things were discovered.
That's so neat. I have to admit, I haven't actually. It always comes up on all of our exams, but I've never met someone who's seen it. So that's really neat that you actually saw it. Is it you would treat it and people would get better really quickly as like?
The poor people, the malnutrition, and really people who lived in villages and things. So it's very common from nutritional deficiency.
And you know if it's still
I don't know. I'm here now for last 50 plus years. So
when I was trying to read about it, it sort of seemed like it's in conditions of famine, it kind of pops up, but even but that otherwise it's really not that common anymore. Yeah.
Now, Rohit and Francine found this article that related to the pregnant patient that you had presented in your book. This was a case report of a woman. I think it was reported, came from the Washington Post, but I think she was West Coast. And it was a teenager who became pregnant and developed the symptoms of that, was it DM, whatever?
Yeah, NMDA receptor.
Yeah. And it took them a while, as you would expect. They found a tumor on the woman's ovary, so they removed it. She didn't get any better. And then, not knowing whether it would work or not, they said the only thing we've got left is to terminate the pregnancy. She was in the 18-20 week range at that point. And they did terminate the pregnancy, and her symptoms melted away. So it was an instance in which it was precipitated by the pregnancy. And what was even more remarkable to me was, having gone through that, within a year or two, she was pregnant again. And
did fine, or did?
And the second pregnancy had no complications, but just not only an extremely rare condition, but also the perspective of a patient who went through that and was brave enough to try a pregnancy again.
I guess the overlap of OB and neurology.
Right.
And it's not ephemeral neuropathy.
Yes. But, oh,
Yeah,
well.
there have been some wild cases because there's been some wild cases of NMD receptor encephalitis that we've had. There was one at CHOP where there was at the Children's Hospital where the patient thought that she was in Frozen. So the stories of them are just completely, I'm sort of always amazed at them.
Mhm.
And it's also neat. There are some patients that I think the relapse rate's not actually that low. So I want to say it's something like 25%. But when people relapse, it's like everyone knows exactly what it is. And it's kind of
Yeah.
also interesting to see patients come back or families come back and say, like, look, this is exactly what it is. Get me steroids right now. So it's just it's a wild disease. And then it's also, the field has become much broader now. So there's now tons of different antibodies that people are testing for, and it even goes beyond that. So I had a patient earlier this year who I didn't think it was an autoimmune encephalitis at all, and he had a lumbar puncture. All of the actual antibodies that they tested for came back negative, but what they can do is they actually just stain a slice of a rat brain, and that came back floridly positive. So the thought is that he has some sort of antibody-mediated encephalitis, but we don't know what antibody it is yet. So it's kind of a neat place to be in the field.
Wow. It's also good for you to be able to be at a place that can do those sorts of things, and you have the contacts and everything. Karen or Gordon, your screen is on.
So my main source of new medical information is usually listening to podcasts as I walk through the woods. So on that thought, I was listening to one where they were describing a patient who had Parkinson's disease, who, this is relatively new information, so I just thought it was fascinating, who was a church-going person, had never done anything sort of dangerous in her life, and she was introduced to gambling, and she became a compulsive gambler. And apparently that's not an unusual thing. I just thought it was just interesting.
Was it oftentimes was it a medication, or it wasn't mediated by medication?
Yeah, I mean, so that, yes, so, and I'm going to forget exactly what the pathophysiology
Yeah, it's
was.
usually dopamine agonists.
Yes, right. So, right. So what happened is that even the idea of gambling would increase her dopamine levels. And so she was like addicted to that feeling, but she was a doctor's wife and was very well established. She had children and grandchildren. She was very good to them. And she wound up losing her house and everything else. And my son, Sara, knows, he actually, he teaches computational neuroscience, and he said, oh, gee, I just went to a lecture on that. So I guess it's becoming a thing that I never, so apparently patients with Parkinson's should not be introduced to gambling because they just can't stop.
Yeah, those medications are, they can really ruin people's lives. I actually was looking, when I was writing this book, I remember I was looking for cases, and I actually had thought about using dopamine agonists as an example in the Invaders chapter, because I was sort of thinking like drugs that have dramatic side effects. And then the story that I was going to do ended up being so depressing that I was like, I don't think I could even write it. But it was a guy who literally he ended up on this, on the street and totally homeless. And they're just those medications, they're great for some people, but they could just be
in this case, the person decided to make the painful decision to go off medication, and she had, obviously her Parkinson's just came back with a vengeance, and she had been a real good functioning human being for a short period of time before she was introduced to gambling and then ruined her life. But anyway, was pretty remarkable.
Any other questions or comments from the group? I would like to thank you so much for joining us. It was a pleasure to read your book, and you really kicked this group up a couple levels by actually being here and talking to us today. This is only the second time we've had an author interview, and yeah, I'm just really grateful for you taking the time to be with us. Thank you so much.
Thank you so much. This was so fun. I really appreciate the questions. If you guys are still running in 6 years, I'd love to come back with the next one.
Okay, well, we'll be awaiting publication. Thanks.
But yeah, thanks. This is really nice to get to talk. And this is so neat that you have this group. It's awesome.
Thank you.